What's going on, everybody? My name is Eli, and welcome back to my YouTube channel. So in today's video, I'm going to be continuing the series that I've been working on. Basically, I've been doing an application cycle series where I did a video where you can fill out the ADSAS with me, which is the dental school application. Then I did another video talking about what's next after you submit your application. So now I wanted to talk about a very important topic, a video that I definitely needed when I was a pre-dent, which is choosing the right dental school for you. If you're new to the channel, my name is Eli. I'm a second-year dental student at Boston University, Henry M. Goldman School of Dental Medicine. On this channel, I make vlogs following my dental school journey, as well as videos for pre-dents who are looking to get to the next level. So if you find this video or my channel interesting, please make sure you subscribe, like and comment under the video, share the video or the channel with anyone you think may find it beneficial. So as the application cycle goes on, you're gonna start being faced with a tough choice. December 1st comes around, and if you've had multiple interviews, there's a chance that you can be accepted into multiple schools. And then you'll be faced with the choice of choosing which dental school you want to attend. I know that since June 1st, applications have started to be submitted, but I figured it was important to make this video now because you can always add more schools to your application as long as it's before the application deadline. And also, as you start receiving interview invitations, some of the things I mentioned in this video are things that you're gonna wanna ask your interviewer about when they ask if you have any questions about the school or the curriculum, etc. So I figured now is a good time to make this video and release it before you guys start going on your interviews, before you start getting your acceptances, and you have to choose what school you want to attend or even what school you want to apply to. So as I mentioned before, this is definitely a video that I needed when I was a pre-dent. I felt like when I was applying, I still was kind of in the space of not knowing much about the dental school application cycle. Obviously, I had help from people, which helped me a lot, but there were things that people mentioned that I just had no idea what they were talking about. Whenever someone brought up class size or block schedules or stuff like that, I didn't really understand the importance of it. And I feel like now, after finishing a year of dental school, this is my chance to really relay that information to everyone that watches my channel and explain kind of what they mean by these things and why these criteria are so important when it comes to choosing a dental school. So I wrote down a quick list of criteria of things that I think are important to consider when choosing a dental school. I'm gonna list them out right here to start the video off, but I'm gonna elaborate on every one of them briefly, not to keep you too long, but just so you can understand why these things are important. So I think my criteria, or the most important criteria when it comes to choosing a dental school, are the cost of attendance, the class size, the location, the curriculum / the culture of the school, the community outreach of the school, and specialties. So first things first, let's talk about what I think is probably everyone's most important factor when choosing a dental school, and that's the cost of attendance. Everyone knows dental school tuition is expensive, but it can vary widely depending on where you attend. So I'll use myself for example. My school, Boston University, tuition is $85,000 a year. My state school, University of Maryland, the tuition is $26,000 a year. That's a very big difference. That's something that's very important when choosing a school to attend. Obviously, I did not get into the University of Maryland, so there was no way for me to consider that when it came to what school I wanted to attend. But that would have weighed very heavily in my decision had I had options between my state school or attending a school out of state that was much more expensive. When I mention cost of attendance, it's important to look past just the tuition of the school. When you're attending a school like University of Maryland, you may be looking at rent prices that are vastly different than a school in New York City or in Boston or in Los Angeles or anything like that. So you have to think about the total cost of attendance and the cost of living in that city. And that brings me to my next point of what I think is important criteria when you are considering a dental school, which is the location. So for my situation, I applied to various schools in different cities that I thought I would like to live in. I went to University of Maryland, I grew up in Maryland. I wanted a chance to get out of my home state, and I thought that school would be a good opportunity to do that because I could always come back after school. 4 years out of state and I can come back. So I figured apply to schools in places that I may want to live, may want to explore. And eventually, when it comes time to choose a school, you really have to think about whether you would want to attend school in this location. So for example, if you grew up in Florida and you're used to 90-degree weather, or your winter means 70 degrees, moving to Boston might be a very big difference for you, and you may become very uncomfortable with that situation. School may be going fine, everything may be fine, but you just can't deal with the weather. And that can affect your performance in school, whether you believe it or not. Someone that's used to being from somewhere sunny, you move to Boston, you don't see the sun rarely ever. It starts snowing in November, it doesn't stop snowing till April. That's a very big difference to what you're used to, and that can affect your performance in school. So it's really important to consider the location of your school when you're choosing where you want to attend. Not necessarily just the city, but compare it to what you're used to. Think about how much of a difference it's going to be. Think about if that's going to be a comfortable situation for you when you start school. Because school is hard enough as it is by itself, so you don't want other factors playing into your performance in school. So this next criteria is something that people mention to me a lot, but I never really understood the importance of it until I actually started dental school, and that's class size. So a lot of people would consider a small class somewhere under 60 students in the class. And then other people would consider a large class over 100 or over 150, etc. My class is 115 people. I would consider us large, mainly because there are people that I still do not know in my class. I may have heard their name before, but I can see them and I have no idea who they are. Partially that's because it's a large class size and the only class that everybody comes to is SimLab, and you don't see everyone in SimLab. But another part to that is simply because when you have a class size that large, you don't have the chance to really speak to or make friends with every single one of your classmates. It's really kind of just who you introduce yourself to in your orientation week and who sticks around long enough to actually be a friend or be part of your study group. In a class size like 115 people, I didn't find it too hard to meet my classmates. I will say I do know a majority of them. However, there are bigger schools that have class sizes of 200 or 250, and there are smaller schools that have class sizes of 35. So it's really all about what you want, what type of relationship you want with your classmates, etc. I also think that class size ties into the faculty to student ratio. When you're in the sim lab, how many faculty members are in there to help you compared to how many students there are? When we're in sim lab, I couldn't tell you how many professors are in there, but it's probably somewhere between 10 and 15, and there's 115 of us. It's not too hard to get a professor's attention, but sometimes it can feel very, very difficult, especially if you're in a rush to get checked off or if you're taking a summative exam. So these are some things that you may want to consider when you're considering where you want to go to dental school. Another important factor that I mentioned, and I think this may be number 2 right behind the cost of attendance, the curriculum and the culture of the school. Here's a personal example for me. There was an interview that I went on, and as soon as I left that interview, I knew it did not matter whether I got into that school or not, I wasn't going. I wasn't a fan of the interview. I wasn't a fan of the professors that interviewed me. I felt like they had no interest in me. I felt like attending the school would have looked just like how my interview did. And I already knew after the interview that school was off limits for me, and that's fine. Sometimes you don't get the right vibe from your interview, and you got to take that instinct and run with it. If you don't like the interview, you're not gonna like the school. But let's talk about the school culture as far as whether it's a competitive or collaborative environment. When you get the chance to talk to students that attend the school, ask them the hard questions. What are your classmates like? What do you think about your class? Do people help each other? Are there gunners? Are there people that's always trying to get an advantage over other students so they could be at the top of the class? Those are important things to think about because it can make your school experience very uncomfortable if that's not what you're used to, if that's not what your undergrad institution was like. it's something that needs to go into consideration. And that's why it's so important to talk to current students at the schools that you're looking to attend, because they'll give you the real. You can ask a professor anything you want, but at the end of the day, if they want you to come to their school, they're going to tell you all the nice things and leave out all the bad stuff. So when I mentioned that, I also mentioned curriculum, because every school's curriculum is different, and sometimes in a grand scheme, sometimes in tiny things. So for example, there's 3 dental schools in Boston: BU, which is my school, Tufts University, and Harvard University. The curriculum, obviously, you're learning generally the same thing, but each one of the 3 schools have a different type of schedule. In my school, we have a certain number of classes that we take every semester. It's kind of like undergrad, and that's just it. Whereas at Tufts, I believe they learn in more of a block schedule where they'll take one class for a certain amount of weeks, take the final exam, and move on to the next class. At Harvard, they take their first year classes with the medical students. You're basically a med student in your first year. So 3 different schools in the same city, 3 different ways that we all learn. Think about what you want, think about what's comfortable for you, ask in your interview what type of schedule they have, and decide what works best for you and the way that you learn. Another thing that I mentioned is community outreach. When I interviewed at my school, they mentioned that in the first year they have a service learning class, or basically a service learning project, where you go to a nearby elementary school and you educate them on oral health. That was a big selling point to me, especially because I was community service oriented before I got into dental school. I knew that I wanted to use my education to help promote oral health in my community. Obviously, you guys see what I do with my YouTube channel, but being able to have the opportunity to go to a school and talk to young kids about the effects of what they eat on their teeth and things like that was something that really interested me. And then in the second semester, we got a chance to go back to the schools and place sealants on the teeth for the young kids. So I was able to basically see a patient in my first year. So that's something you want to ask about when you're in your interview. What do you guys do for community service? What kind of programs do you do for community surrounding your dental school? If that's something that's important to you, then that's something you want to ask about, so you know when it comes time to choose a school, you know which one aligns best with what you want to do and your morals and your beliefs. So the final point I'm going to touch on, specialties. People used to mention this to me when I was a pre-dent, told me to ask schools, you know, what specialties you have at the school, do you have any specialties at the school? And for the life of me, before I started dental school, I could not understand why that really mattered. Now I see that it matters for a number of reasons, but mainly because when you're in dental school, you start seeing patients in your 3rd year. You may see complicated patients, you may see simple things, etc. When you have specialists at your school and the patient is a patient of the school, you can refer them to the specialist at your school, whether it's an ortho case or a complicated root canal that needs to see an endo specialist, etc. There's a trade-off for that. One, being able to refer people to specialists, which is something that you are probably going to run into in the real world, allows you to develop relationships with specialists. Also, as a student at the school, you can learn from the specialists, especially if those are one of the specialties that you're interested in. If your school has specialties, there's also a good chance that you can get accepted into the ones at your school and stay where you are. But then there's also benefits to not having specialties at your school. When you're seeing patients in the clinic, you will be dealing with those more complicated patients, and you know that could help you when it comes to applying to residencies and applying to specialties, or that could help you when you're out in practice. If you're a general dentist and you're used to seeing more complicated patients, you may not always have to refer out, and you can see more patients, get more money, build your patient base, etc. So that is something to consider when it comes to choosing a dental school, but it requires a little bit of thinking ahead about what kind of dentist you're going to want to be after you graduate. So those are all my criteria when it comes to picking a dental school. I hope this video helped, and I hope I could explain some things that you may have heard around or heard on Student Doctor Network or Reddit, or just heard from other dentists and didn't really understand what they meant when they were talking about those things. I know like class size and specialties were things that I heard everyone mentioning that I just couldn't see what the importance was or why everyone mentioned that it was important to consider those things. And now that I finished my first year, I'm glad that I'm able to kind of break those things down and explain it to someone who may also have the same questions that I did. So thank you all for watching the video. I hope it helped a lot. Stay tuned for the rest of the videos in this series. Make sure you subscribe, make sure you share the video with anyone else that may need it, and I'll see y'all in the next one. Peace.